All right, good evening, everybody. Can you hear me? Thank you so much for attending our dog chat tonight. Our COVID-19 vaccine, what women need to know. We have a distinguished list of guests here with us today, and I do mean distinguished. So tonight is for you all. We'll get started here with some introductions and a couple of introductory questions, but then please, we have staff members that are here, or you can just raise your hand. We just want this to be a comfortable chat format, not very formal, so please feel free to ask any questions that you may have. If there's anything you're not comfortable asking out loud, you can send a note to me or our staff member Jen. You can give her a note as well. So again, we just want to make sure that you have this opportunity while we have these amazing women here with us tonight. So without further ado, I'm going to introduce our panelists. First, we have Dr. Stephanie Allen. Dr. Allen is the Chief of Obstetrics and Gynecology at Piedmont Athens Regional Medical Center, and she's a physician at Women's Healthcare Associates. She's a board certified by the American Board of Obstetrics and Gynecology. I'm gonna learn how to say that word nicely by the end of tonight. She's also a fellow of the American College of Obstetrics and Gynecology and a member of the American Congress of Obstetrics and Gynecology. Dr. Allen received her medical degree from the James H. Quillen College of Medicine at East Tennessee State University and completed her postgraduate work in obstetrics and gynecology at Bethesda Hospital in Cincinnati, Ohio. Next, we're joined by Dr. Jane Morgan. She's a cardiologist and is the clinical director of the COVID Task Force at the Piedmont Healthcare Corporation in Atlanta. Prior to her current position, she served as the Director of Innovation and the Director of Cardiovascular Research at Piedmont. Dr. Morgan is a native Atlantan and completed her BS degree at Spelman College, her medical degree at Michigan State University, her internal residency at George Washington University, and both her cardiology and pacemaker fellowships at Mount Sinai Medical Center in Miami, Florida. And next, we have Coach Joni Taylor. Coach Taylor is heading into her 7th season as the head coach of the Georgia Lady Bulldog basketball team. During the 2020-21 campaign, Taylor guided her team to a 21-7 record and 4th place finish in the SEC. The Lady Bulldogs also advanced to the SEC Tournament Championship game for the first time since 2004 and earned its highest NCAA tournament seeding since 2007. Coach Taylor was named as the 2021 Southeastern Conference Coach of the Year and National Coach of the Year finalist. She's also heavily involved in the Athens community and created the award-winning Beyond Basketball program, which is a meeting place for women in Athens to discuss happenings and issues in and around the area. Coach Taylor is a native of Meridian, Mississippi, and earned a bachelor's degree in education from the University of Alabama. And last but certainly not least, we have Alyssa Perez-Lagonas. She is a rising senior on the UGA gymnastics team where she competes in the floor exercise and balance beam for the GymDogs. She's from Duluth, Georgia, and is pursuing a Bachelor of Arts in Criminal Justice with hopes of continuing on to law school. And she's passionate about social justice and diversity issues, and she serves as a member of our Student Athlete Diversity, Equity, and Inclusion Committee. So first of all, y'all, we want to thank you all for being here. Please give these women a wonderful round of applause for being here tonight. So we wanted to start out with a quick video before we jump into our questioning. We want to thank Dr. Morgan for this video, but we thought it was appropriate given our topic tonight. So we'll go ahead and start.
I'm Morgan, and I thought I would just take a moment to review the myths and fallacies of COVID-19 and the vaccines. So number one, the flu kills more people than COVID-19. This is not true. COVID-19 has killed more people in the past year than the flu has killed in the past 5 years combined. Melanin in your skin will protect you from COVID-19. This is not true. Melanin in any amount does not confer protection from COVID-19. If I were to get the COVID-19 vaccine, all of our future babies will be sick. This is not true. There's no scientific data to support negative impact on reproduction and fertility. As long as I exercise and take vitamins, I can avoid COVID-19. This is not true. COVID-19 vaccine will actually give me COVID-19. Not true. Scientists should rule the world.
Absolutely. All right. So with that, we will go ahead and start with our first question. So can each of you just talk a little bit about what has been your personal experience or exposure to COVID-19, and how did that impact your decision about vaccination?
I'll go first. First of all, it's good to see everybody. And when we got shut down March of 20, we had just finished the SEC tournament, and I was on the road doing home visits. So COVID-19 had come to the United States, but it still wasn't in Georgia, in the South, and I was in the Atlanta airport every day. I was in the home of prospects every day. And I'll never forget it. I can say it now because she's here, but I was in Charlotte, North Carolina, in the home of Reagan Richardson. She's a freshman on campus now. And when I finished the home visit, I picked up my phone and I had like 50 messages. And it was Commissioner Sankey. It was the NBA just got shut down. It was, if you're out on the road, please go home. And so I remember getting in the car and calling and trying to figure out what the heck happened, like in this 3-hour time span from me walking into this home and into coming out. We had an emergency head coaches meeting and all staff meeting the next day. I was driving back home as that happened. I had to cancel the rest of my plans. And my husband calls me and he says, because of your exposure and being in the airport, and we just don't know. And you got to remember, this was back when there were no tests, right? You couldn't get tests. You just had to, unless you were really, really sick, you were just, if you think you've been somewhere quarantined, there were no tests available. And he said, I'm gonna need you to go to the basement and quarantine for 7 days because you've been in the airport. Mind you, we have a 2-year-old and a 4-year-old, so then they were 1 and 3, and both of our parents, who were both all over 65, were with us because we were just coming from the tournament. And they were like, it's just too much of a risk, we know nothing about this, so the basement door is unlocked. Go to the basement and I'll see you in 7 days. And so I spent 7 days in the basement, and it gave me a chance to really dive into COVID-19, the coronavirus, the virus back then, and what it meant and the risk that I could have given to the people in my household if I would have not quarantined. And of course, I didn't have COVID, but we didn't know. And all I could think about in that moment was, as much as I don't want to be down here by myself, as much as I want to go see my family, my husband, my kids, how terrible would I feel if I did have COVID and did not know it and passed it on to my mom, who was 78, or my dad, who was 74, my young child. And from that moment on, we just took a very conservative approach to COVID-19 until we could find out more about it, because we just didn't know anything about it. And so as this year has evolved, I have been fortunate that nobody in my immediate family has had a really bad impact to COVID, but I know so many people who have lost lives, staff members whose family members have passed away from COVID, and it's just something that I believe in science. I believe in, doing what's the best to keep everybody around us safe. And I personally chose to get the vaccine because I just told you about what happened last year. I just got off the road today recruiting. I'm around a lot of people. We're traveling all the time. We are exposed to fans, different people. And then I'm bringing that back into our home. And again, I don't want that on my conscience. And so it's, if I got COVID-19, would I survive it? Sure, that's what I believe, because I do believe if I work out, and I'm joking. But I think I would survive COVID if I got it, but I don't know if my mom would, I don't know if my dad would, I don't know if my 2-year-old daughter would, so I just don't want that on my conscience, and I want to get back to normal. I want to be able to visit friends and family freely and not wonder or not say, hey, you have to take a test before you come into my home, because that's what happens right now. Even now, even if you're vaccinated, if I don't know your surroundings, I'm like, can you take a test before you come to our house? And so anything that I can do to protect those around me and our team, our players, the people that I'm around, just because of how in and out I am with travel, I wanted to do. And so that is why I personally got the vaccine, and have taken the coronavirus so seriously, because it just came out of nowhere and just, we were all trying to figure it out and still trying to figure it out. That's why we're here today, to continue to educate ourselves and learn more about it. But it's something that's, I fear things, and I believe in the numbers, and we just took it very seriously.
I'll probably echo that with, that's loud. I would echo that with, my experience is very similar with when it started being sort of in the community more, when we started having access to tests and were able to test patients in labor and delivery, and knowing that it had found our community. In order to protect my family, my experience was so interesting in that I started wearing scrubs to work every day. We started seeing patients in the office pretty much just who required obstetrical care. We stopped seeing GYN patients, stopped doing annual exams. We were only seeing OB patients, pregnant patients. So I only wear scrubs to work. When I went to the hospital, I would change into the hospital scrubs, then change back into my office scrubs. If I went to the other hospital, I would change again. When I went home, I got undressed in the garage and went and took the scrubs directly into the laundry room. I would shower immediately. If I was on call and I went back to the hospital, I would repeat that and shower again. I would sometimes have to wash my hair 2 or 3 times a day for that process. And that was just because at the time, we didn't know much about contact. We thought, okay, this is a respiratory thing, but I also was socially distanced from my family at that time. Psychologically, it was really stressful. So we weren't testing at that time patients in labor. We didn't have access to tests, so we had to kind of assume everybody was positive. When we started testing patients in labor, we found a lot of asymptomatic positives. Access to masks was not as robust as we liked. It became more robust at the hospital, which was thankfully appreciated. So yeah, I chose to get vaccinated. When it came available in December, I use the term almost a miracle, a scientific miracle, because I immediately thought of not really myself, because I'm with Coach Taylor, that I feel like I would survive it, that I'm healthy, I exercise, but my fear was what my exposure would be to the people around me. My family, my husband, my children as they return from college, my parents, my husband's parents, my patients, my obstetrical patients, my patients who are pregnant, who, as we've learned, are at higher risk than the general population if they were to get infected. So, yeah, I had a really interesting time with COVID as a provider. I thought my hair was going to break off as many times as I was washing it.
See, is this on? Oh, okay. I would have to agree that my ultimate decision came down to the people that I was around. I'm very family oriented, and I live only 40 minutes away, and my grandmother, she's 80 years old, and it killed me to not be able to see her as often as I wanted to. And at first, my thought was a big maybe for the vaccine, and it was just because I had lasted this long without COVID. Then around the time that my team was supposed to go to SECs, more than half of my team was either contacted or with it. And so at that point, it was almost like, nail on the head, like, wow, it actually can get really, really close to me. And I think that day I was like, nope, I'm getting the vaccine because it was too close. What if I went to her house and she were to get it, and it would be something on my conscience that I could not take away with me. So then got the vaccine, and it's like, it's a peace thing. I'm at peace more, being able to see her and the people around me and hang out with people without being like, take a step back from me. I don't know what I have. Yeah.
For me, as scientists, sort of more steeped more in research, I was here on UGA's campus visiting my son. was a junior last year, and I was with the Parents Leadership Council. We were having our big weekend meeting. But on, WeChat, I've been talking with colleagues internationally about this SARS-CoV-2 virus and where it was headed, and we were concerned about it. We were concerned for a number of reasons. One, the reason it was named SARS-CoV-2, that means that's an alert to the scientific community that this is the second time we've seen it. So when did we see it the first time? We saw it in 2003 when we had our first SARS outbreak. And by and large, our pandemic surveillance team was in place internationally. We were able to keep that outside of the United States, but alarm bells were going off in the scientific community for a number of reasons. One, this is a virus. Viruses replicate and mutate very quickly. They are a formidable foe. And two, it's spread by respiration. And don't forget, we're all Homo sapiens. We're human beings who live on a single planet in the universe, Earth. Earth is made up of hydrogen, oxygen, nitrogen. That's it, carbon. We cannot opt out of air. We can't say, you know what, I'm just not going to breathe this year because I don't want the virus. So it's unlike other infections that could be bloodborne or waterborne or fecal-borne or body fluids, where with some discomfort you can isolate yourself and create some barriers. We can't opt out of air. So we were very concerned on WeChat that there's this SARS-CoV-2, and you may not remember, but in 2012 we had a sister outbreak called MERS, Middle Eastern Respiratory Syndrome. 70% homology to the SARS outbreak in 2003. By and large, we were able once again to contain it to Saudi Arabia, but alarm bells are really ringing now in the scientific community. We've got a big problem. We've had 2 outbreaks of this virus, and we've been lucky we've been able to contain it. So when I was here on campus in February, SARS-CoV-2 was already known in China, perhaps in Italy. And I was standing in the Innovation Center, actually, with my son. And during the break, he has asthma. I was talking to him, what I thought was quiet. We were having a conversation, and I was saying, look, there's something that's coming. I don't know exactly what it is, but it's respiratory borne. It's a virus. We had no treatment for it. And I was talking with him really about eating healthy. I need you to eat healthily. I need you to take vitamins. I need for you to stop all this nonsense, whatever you're doing. I need for you to really take this seriously because you take your asthma medicines, that kind of thing. I wanted to make sure he was being compliant in as much as possible. Interestingly, a woman walked over to me and she said, "Are you a doctor?" And she said, "Yes." She said, "I heard you talking to your son. I was having the exact same conversation with my son over here." So interesting, the 2 women who were there as were listening, were understanding what was happening. We have no treatment for it, and we're already talking with our children. So we were here on the Parents Leadership Council in February. We are warning them that we need you to begin to take precautions. So, we knew that it was going to be serious. We didn't know how quickly it would spread, but we know as human beings, we require air. And this is a virus that spreads by air. So we already know just that one statement that it's going to be a problem. And so that was one of the reasons when the vaccine became available. I was immunized on January 2nd. I got Moderna, my first dose on January 2nd. I think the vaccine became available in December. I was not on the front line to get it in December, but I was the second level. I don't know if you guys remember, it rolled out in different groups. So I was not a frontline healthcare worker, so I got it as soon as I could in New Year, the day after New Year's on January 2nd. I think, again, like Alyssa, I just felt relieved. I felt that I was doing what I could for my family. I was doing what I could to keep myself safe. I have 3 sons. They all got the vaccine. One got Moderna, one got Pfizer, and one got J&J. So that's there's different things, different circumstances. We got them when we could. And so we've sort of been all over the board with it. My husband is ex-military. He went to the VA and also was immunized. So our entire family took it very, very, very seriously to try to protect ourselves. And the last thing that I will say is even though you're healthy and you may not get sick with COVID, 30% of you, after a COVID infection, will go on to develop long haul syndrome. And we have no way of identifying who's going to develop that. We have no way of preventing it, and it cuts across all lines: gender, race, culture, socioeconomic status, education, age, number of chronic medical conditions. We don't know who's going to develop long-haul syndrome. We can't prevent it, we can't intervene, and we can't treat it. We have nothing. And even though you are healthy now, if you were to get COVID-19, the tragedy is that down the road you might be sicker than you ever were when you had COVID. Mental issues, memory problems, loss of taste and smell, heart inflammation, lung inflammation, and we have no way to treat it other than supportive measures. And we can't identify who's going to develop it. So it's something to think about. If you were to get COVID, you still have a risk, even if your course is fairly innocuous or safe, healthy, that down the road you actually could be sicker. Previous athletes are unable to climb 2 flights of stairs without being winded, have to chronically catch their breath, are on inhalers, that type of thing. And it's a tragedy to see and to manage these patients who are completely healthy when they get COVID.
Excellent. So this is for our physicians. Some of the hesitancy around the vaccines are the side effects. So wanted to just ask you all, when you're seeing in your patients or people in the medical community or other folks, what are some of the hesitations out there that you want to sort of debunk? Dr. Morgan, you sort of did in your video, particularly around, I know, 2 issues that come up often in regards to your heart and fertility.
So to debunk them?
Yes.
So I'm going to pass fertility to you, and I will double team with you, and then I'll come back on heart issues.
All right, so the fertility thing is really fast. I had to really dig deep. I was like, where did this come from? It's so fascinating to me how these, I'll call them myths, because that's what this is. I'm so fascinated how this shows up. So I had to kind of dig a little, do a deep dive into some internet searches where we think this showed up. And I like to say, these myth things sort of like pop up like mushrooms after a rainstorm. But what happened with that is that basically a German, I don't know if you'd say physician, I don't think it was even physician, I think it was a letter got written to basically the European version of our FDA by a couple of what I'd like to politely call anti-vaccination folks. That suggested that the vaccination would cause an immune response against a protein that is in the human placenta. And I don't want to get too technical, as I don't want to blow anybody away with, placental protein names and things like that. But where this comes about is that there's basically, everybody's seen the pretty cool, colorful virus diagram with all the little spiky things on it. Well, one of those spike proteins has a very similar, tiny little amount of DNA code that's similar to a tiny little DNA code that's in a protein in the placenta. That's it. So if you get infected with COVID-19, your body's going to make an antibody response. If you get the vaccination, your body's going to make an antibody response. Neither of those antibody responses are in any way, if you're a female, going to attack a future placenta. I 100% promise you that. There is absolutely no placental protein in either of the antibodies that the vaccine is going to have you make or your body's going to make naturally. It doesn't happen. It can't happen. It would be like basically your body confusing the antibody that your body makes naturally. Your immune system basically getting confused between this antibody that's made naturally and this antibody on the protein of the virus with, say, let's put it this way. Let's say that it'd be like your immune system confusing an elephant and a cat because they're both gray, all right? It just doesn't happen. There's these tiny little codes that are similar, but the protein themselves are very, very different. But that took hold in the media among anti-vaxxers that really, really suggested that this could happen. So the best thing I can tell you is let's look to the science. Okay, 2 things. One is that the pharmaceutical companies did indeed exclude pregnant women, which was very unfortunate. Dr. Morgan talked about that in some of her videos, which I think are excellent. And I hate that. But they've subsequently looked now back at women who've subsequently gotten pregnant either just prior to or even after having the vaccines. And we're seeing a lot of really promising things that really there's no increased risk of miscarriage after you're receiving 1 or 2 doses. And if any of you have been vaccinated and you've had these really nifty apps that constantly barrage you with, how are you feeling? How are you feeling? It's called the VSafe app or the VAERS app. They've actually looked at data from these apps, and patients are starting to report back that they've gotten pregnant, and they've looked at the data from these apps and said, wow, women are getting pregnant, and we're seeing no increased risk of miscarriage, birth defects, preterm labor, congenital malformations, which are birth defects, in women who have received the vaccine compared to women who haven't received the vaccine. So we've seen a lot of positive data, so I can just tell you with 100% certainty that I'm convinced that there's absolutely no concern about fertility with these vaccines. Both of my daughters have been vaccinated. They're in your age group. One of them's a college athlete in Florida. I really have no concerns about fertility and vaccinations with this particular vaccine. And I'm happy to take your questions when we get to that portion, but like I said, I don't want to get too, I wish I had a whiteboard and I would draw you pictures, because I like to do that.
And I will address it just from maybe the messenger RNA perspective, and because, what is messenger RNA? Nobody's ever heard of it. All of a sudden we have these vaccines that used to be, live, attenuated or killed vaccines, and now we're talking about this technology called messenger RNA. And isn't messenger RNA DNA? Aren't they the same? They sound pretty similar. So, and messenger RNA being so new. But is it really new? Messenger RNA has been around in scientific laboratories since the 1970s. And one of the reasons that we haven't seen it as much in medical therapeutics is because it denatures, meaning it dissolves or disappears in your body. We can't keep it around long enough to get it to do anything. So once we have gotten it into an emulsion for these vaccines, it literally, once it's injected, it codes for the protein that we need, the spike protein, and then it disappears. It's gone. So that's why we are not anticipating any long-term side effects, because you can't have long-term side effects from something that's not there. It's literally gone from your body. So that's the beauty of messenger RNA, unlike previous vaccines that stayed for a long period of time. That's also why there are not issues with allergies and those types of things, because of the messenger RNA. So that's just another aspect when we talk about this long-term effects, long-term side effects, and impacts on fertility and impacts on reproduction for women.
Okay, I have a question about so with vaccine, I've heard different things about how it could possibly prevent I know once you have a vaccine, it helps you fight it off, it helps you combat the virus. But my question's how protective is it against getting the virus to begin with, if that makes sense?
Yeah. So a couple of things, and I'm going to sort of discuss this for a second. So Moderna has 94.5% efficacy, meaning how well it works at preventing you from having severe disease or symptomatic disease. Pfizer is at 95%, and Johnson & Johnson is at 72% in the United States, and I just want to talk about that in just a second. So that's how well it works at protecting you from any severe disease. So these are really phenomenal numbers. So for instance, the flu vaccine on any given year is anywhere between 45 and 65%, tops, best. FDA requirements for vaccine efficacy is only 50%. FDA will approve it if you reach 50%. So we've really never seen vaccines that were up in the 90s. That's why people were so blown away. I feel like we've never seen it. So I want to talk a bit about the Johnson & Johnson, because some people are a little bit reluctant about Johnson & Johnson. Why is it only 72%? But don't forget, Johnson & Johnson came third to the market. Moderna and Pfizer were first. Moderna and Pfizer were trialed. Those trials were ongoing. in a different environment of mutations. More mutations were in the environment when Johnson & Johnson was running its trials. You may or may not remember, I don't know how steeped you are in science, but we had the UK variant, the Brazilian variant, the South African variant, the Alpha variant, the Gamma variant. So all of those, Johnson & Johnson was testing its formulation in that environment. Moderna and Pfizer were not. So we can't really compare. It's not apples to apples. Like apples to oranges. So a 72% efficacy for Johnson & Johnson against a much tougher, you guys are all athletes, a much tougher opponent might actually be a better score than a 94 or 95% efficacy against a very easy opponent. So don't forget, this is not math, this is science. So that's why Johnson & Johnson was approved to move forward, because it was trialed in a much more stringent environment of mutations. It came up against a more formidable opponent than Moderna and Pfizer did.
I also have a question off of that. So earlier you mentioned how if you get the COVID, or if you get COVID, there's a higher chance that you will have long in the future. So if you have the vaccine and you still get COVID, are those lessened by any chance? Or what's the deal with that?
So I think I heard two questions. Can you get long haul syndrome after the vaccine?
Basically I'm just saying a person that has the vaccine versus a person that doesn't have the vaccine, and both of them get COVID, does one have a better chance of not seeing future problems?
I see what you're saying. So the answer to that is yes. One, what we call this viral load, your viral load, which determines not only how contagious you are to others, but also how sick you may become. Your viral load is greatly contained if you have the vaccine on board. So even if you are the unlucky ones to be in that 5%, remember the vaccines are not 100%, right? 94, 95. So if you're in the unlucky, you're in that small percent that gets COVID, even though you're immunized, you can anticipate a much milder course. Very comfortable, but also you're less infectious and contagious to those around you. So people around you are safer because you've gotten a vaccine and you've been immunized. We have data now that is also showing us that if you have those patients with long haul syndrome, when they get the vaccination, their symptoms have started to improve in patients who have long haul syndrome.
Thank you.
Dr. Morgan, this is in concern with the myocarditis. So I had COVID with a 1.5 atrial septal defect and was completely asymptomatic. I lost my smell. And now thinking that the vaccine could even give you a chance of giving myocarditis is kind of scary to me, because I'm an unlucky girl. And I'm just not very lucky when it comes to heart things. And I received bypass surgery a year ago, so that's my concern. So I was wanting to know if you could elaborate on myocarditis.
Yeah.
Myocarditis.
This is an excellent question. What's your name?
Mallory.
Mallory. Okay, so Mallory has an ASD, atrial septal defect, and she's had open heart surgery bypass. What do we know about these kinds of patients in our clinical trials? So when we looked at those clinical trials, don't forget over 110,000 people are enrolled. All types of chronic medical conditions were included. So patients with significant cardiac disease in the Moderna trial, more than 2,200 people were included in those trials. In the Pfizer trial, more than 3,000. In Johnson & Johnson, more than 3,000. People with chronic lung disease, people with liver disease, people with HIV, cancers of all types were included in these trials. So even though the trials were not designed to specifically study people with chronic medical conditions, they were not excluded either. And what we know is that if you have a chronic medical condition like a cardiac condition, if you were to get COVID-19, the disease, you are 6 times more likely to be admitted to the hospital than someone else with COVID-19 who does not have heart disease. Once you're in the hospital, if you want to talk about unlucky and you have a chronic cardiac condition, you are 12 times more likely to die than another patient in the hospital with COVID-19 who does not have a significant cardiac condition. All chronic medical conditions, all people, all, I'm using the word all, it's an unusual word to use in science. You probably don't understand how unusual. We almost never say 2 words. We never say all, we never say never. Those are 2 words. If those are on your board exams, the answer is no, pick something else. Never all. But I'm going to say all patients with chronic medical conditions should move forward with getting this vaccine to protect yourself, because you are at a greater risk of more complications and more hospitalizations if you don't. And if you are wondering if you have a chronic medical condition, if you take a prescription medication for any reason on any regular interval, then that's you. You've got a chronic medical condition. That's your inhaler for asthma, that's B12 injections for anemia, that's whatever you're taking. That's your chronic medical condition. So absolutely, I would say you should move forward with the vaccine. So the other question you asked me about was myocarditis. So myocarditis is a rare side effect of the messenger RNA vaccines. The messenger RNA vaccines are Pfizer and Moderna. It is not a side effect of the Johnson & Johnson vaccine. That's number 1. So you can think about how you might select vaccines. Secondly, the incidences of myocarditis, this is inflammation of the heart, have almost exclusively occurred in males, not in females, in males, young males, and they are treated and have been self-limiting. We have not seen people die from it, but certainly it can cause chest pain, it can cause discomfort, you may be in a hospital, we treat you for it, but there is a recovery for it. If you were to experience these pains, I'm not minimizing it, I'm saying go to the emergency room, okay? We can treat you, but you gotta go to the emergency room. I'm not saying stay home. So if you were to have these symptoms, chest pain, shortness of breath, go to the emergency room if you've had your vaccine, so you can be treated for myocarditis. But again, we see it in young males, not females. It's rare, it's incredibly rare in females. Chronic medical conditions of any type should move forward with the vaccine sooner rather than later.
Thought I saw a hand in the back.
Here. Sorry, we'll get to know each other a little bit better. Can you tell us your name?
Yes, my name's Jordan Shepard. I'm an incoming senior at UGA, but I also serve as the student intern for UGA men's basketball.
What's your favorite color?
Blue.
Okay, you can ask your question now.
My questions are more specifically for Dr. Morgan and Dr. Allen. So even though we work within athletics, and I'm sure that a lot of us have taken extreme precautions in keeping one another safe and being able to maintain in the same spaces, with most campuses returning back to full classrooms and kind of full capacity in a lot of spaces, what do you anticipate statistics are going to look like from the medical and scientific perspective with UGA being a campus of about 35,000 students? What do you think is going to be the outcome when we return in the fall?
I can only speak just generally from what I'm hearing in the medical community. Before I came here tonight, I kind of touched base with some of my colleagues that are treating COVID-19 patients in the hospital right now. And I think the unfortunate thing that we're seeing in the hospital is that the vast majority of inpatient admissions and ICU admissions are between the ages of about 18 and 30. And I think that's very concerning to me. And I think unfortunately it's because most of those ages are unvaccinated. Because most of, my grandparents got vaccinated, my mom and dad got vaccinated, I got vaccinated. So I do have concerns about large gatherings and the UGA community and college communities and people, and vaccination rates in Georgia in general being lower than the national average. So.
Yeah, no, I 100% concur, and I think we have to think about where we are. We are in a state with a low vaccination rate, and I think you have to assess what your environment is and what your community is. And if we're living in a state with a low vaccination rate, less than 40%, then you need to think about masking, even if you are immunized, depending on what your environment is, because we set up a situation where we have more mutations that can develop. Don't forget, as human beings, we are the host of this virus. The virus doesn't live without invading our bodies. It needs us. So if we continue to allow ourselves to be available for the virus to invade, it can replicate, and then subsequent mutations, not all of the time, but there are occasions like this Delta variant with subsequent mutations can become smarter, can become more contagious, they can cause severe disease, and we start to kind of continue to go down this slippery slope. So, I think if you're in other regions of the country or another state or even in a city that you know is well vaccinated, then, you need to gauge where you are and then make decisions accordingly. So I think it's going to be interesting. Dr. Allen was, absolutely correct. We have 99.2% of all of the patients currently hospitalized here in the United States with COVID-19 are unvaccinated. 99.2, that's almost 100%. So if that doesn't tell you that vaccines work, 99.2% are vaccinated, and we have seen our numbers certainly at Piedmont, which is the largest healthcare system here in the state of Georgia. We are seeing our numbers tick up every single day, up. I watched them over the weekend and actually sent an email when I got the numbers that came in over Saturday and Sunday. I sent an email with a bunch of frowny faces back. That was totally unscientific. But that's what Dr. Morgan did. I just sent a bunch of sad faces, like, oh my God, we can't get out of this loop.
These are great questions. Any other questions?
I'm sorry, what's your name the first time?
Mallory.
And what sport do you play?
Volleyball.
What's your favorite animal?
A dog. Okay. So I'm not like undermining anything by asking. I'm gonna ask a lot of questions. I'm just prefacing that. But so if the COVID vaccine is 99% effective, then why is me getting it helping other people? Like if say you're at risk but you vaccinated, why is me being not vaccinated hurting you?
So the unvaccinated are a risk to yourself and you're a risk to each other. Don't forget, we're less than 40% vaccinated, so the majority of the state of Georgia is at risk. So you mostly are a risk to yourself. You mostly are a risk to each other. That being said, you still pose a risk to vaccinated people somewhat, because even though we're protected and we may not get sick, we could carry it unknowingly to someone else who is not vaccinated and make them ill. Now that's highly unlikely, but it could happen. The reason it's unlikely is because of what I said earlier. If you're vaccinated, your viral load will be low. So not only will you be unlikely to get sick, because you have so few viral particles, you're unlikely to pass them on to others. So that's why the CDC came out to say immunized people really can unmask because you're fairly protected. But if you're unimmunized, the risk is to yourself, the risk is to others. And don't forget, we always have segments of the population that cannot be immunized. In this particular case, it is our children. Our children have no options. So we have to think about that, because people are bringing their children into environments where people are unmasked. Supposedly, that's supposed to mean if you're unmasked that everybody's vaccinated. So you can bring your children in safely, but that's not what that means, because people are unvaccinated or unmasked as well. And so we don't know where these variants are coming, where they're going. The Delta variant, which I often don't speak about, is just the latest one to come. And you may notice that the lingo is changing. They suddenly have stopped talking about mutations and have started talking about variants. That's a scientific term that is significant. A variant is comprised of multiple mutations together. So we've gone from talking about single mutations to talking about variants. The Delta variant, for instance, is made up of 13 to 15 mutations, all pulled together. We've got the Lambda variant that we're watching in South America coming forward. We've got the Delta Plus that we're watching in India. So this is just the latest of things that are to come. And what happens is, if we have pockets in our community that are unvaccinated, those pockets represent areas where the virus can thrive and mutate. And then those mutations interact with people who are immunized and threaten to evade the immunization status of others, because the formulations from the company weren't developed when those mutations were around, right? So now if we're immunized and you've developed a mutation that evades my immunization status, now my vaccine doesn't work anymore. And we're all starting over again. Like, we just keep going back to square one. So that brings me to the question that people often ask about boosters. Are we going to have boosters? I would say probably. And the word booster is a term that's being used loosely, but probably what will happen is that we will have, the vaccine companies will have to go back and develop complete reformulations to combat all of the mutations that have developed since their clinical trials closed. We are loosely calling them under one big umbrella boosters, but really it will be a complete new vaccination program if we can't get our acts together and move forward with our vaccination status. So we are trying, you've heard Fauci and CDC say, hold on right now for boosters, hold on right now for boosters, because we'd like to see if we can, get our communities up as high as possible, such that we can determine what types of boosters that need to be developed. But, in the hospital, we're seeing our numbers increase. They are, by and large, of unvaccinated people. They are younger and younger than they used to be. It's increasingly tragic and sad. By and large, if you're young and healthy, you probably will be fine. You run a 30% risk of developing long haul syndrome. I mean, it's kind of like pulling a bullet in the chamber of a gun and spinning it and just like, let's see what happens. So, try to minimize this kind of degree of invincibility. We're not all invincible, and there can be consequences from our decisions. For some, there will be no consequences, but for others, there could be very serious consequences.
We're coming close to the end of our time, but I wanted to make sure I got in. See a couple questions here, so.
I also didn't get your name the first time.
Megan.
And what sport do you play?
Volleyball.
What's your shoe size?
11. Okay, so clearly I have a mask on, I'm not vaccinated, and I've really been putting a lot of thought into this and stuff. And one of my big things is I've been constantly being told all the benefits and stuff. And obviously there's a lot of misguiding information, news, media, whatever, about the possible risks. And I just want to hear from professionals about it. What are some of the actual possible risks, and are those things to consider? Because at this point I'm just nervous about if I were that one, which I know is extreme to say, but I am a healthy young lady and I'm not trying to be invincible by any means, but I still have a fear of the possibility of something happening that I wouldn't want to happen.
I mean, I think from what I have seen and what I've experienced personally within my family and within my patients, the short-term risks are exactly what you hear your friends experience, which are really just mild in nature. And that has been, for me, was arm pain, I'd done lots of overhead presses. The second dose, I had a very mild temperature elevation. It was at 30 hours, and I think I just overdone it that day. And really fatigued and was really tired. And that's really been the vast majority of, I'd say, side effects. I think a lot of the questions are about long-term side effects. I think the data right now that we have, we're at, I guess, a year and a half from when they started developing these. It's been, they came out in December, so we're at 8 months, 9 months. So we're really not able to tell you long term, but I think that as Dr. Morgan spoke to, that these mRNA vaccines have been out for a long time. I feel really strongly that long term side effects are going to be minimal to none. And the short term side effects are what a lot of you have heard of or experienced personally. I did take the day off. I made sure I wasn't on call that day. My daughter, who's an athlete, took the day off from training. But otherwise, that's what I can speak to. But I'm sure what most of your question is long term.
So I'll speak just to, maybe the Johnson & Johnson vaccine. You guys may have heard that, there was a big pause on the Johnson & Johnson vaccine, and this CVST, cerebral venous sinus thrombosis, so special types of blood clots in the brain. And what does that mean? So there were six women who developed this CVST after Johnson & Johnson was out on the market. Probably more than 7 million doses have been done. So the FDA paused that trial and took a closer look just to kind of see if there's any there. Now, before I go on, I want to say one thing that was very heartening to the scientific community. That pause was maybe scary to other people, but the scientific community was amazed because they halted a distribution with 6 cases out of 7 million. I've never even heard of that. That's how incredibly sensitive it was. Incredibly sensitive. So that was already just whoa, okay, we're being incredibly safe, even though people were concerned from the medical perspective. It's wow, we're being super safe. That's kind of crazy to stop something with 6 out of 7 million. So then when they stopped, what did they find? It was a 10-day pause. They found a total of 15 cases. 15 cases, all women with the exception of one, who had blood clots, either cerebral venous sinus thrombosis or other types of blood clots, maybe in the lung or in the legs. There was one male who had a blood clot during the clinical trials. So of the 14 women, all of them aggregated between the ages of 18 and 50. And then a smaller, most of those aggregated between the ages of 34 and 40. So the majority of those 15 cases were in women between the ages of 34 and 40. Some were on birth control pills, some were not. Some were taking vitamins, some were not. So it was kind of all over the place. One thing that we learned about that is what the risk is from that specific type of vaccine, which is a viral vector vaccine, different from messenger RNA vaccines, and what that risk is of blood clots because of sort of an autoimmune response that can occur that's rare. So the reason I say that is that that's one of the side effects. We're still super rare. Still, even 14 is super rare. And just to put that into perspective, that's 14 in 7 million. Your chances of dying in a car accident are 1 in 77. We're talking about 7 million here. Your chances of developing a blood clot from taking birth control pills, 1 in 1,000. So we
Don't stop your birth control.
Right. So we assume these kinds of risks every day. So I'm just giving you some examples. And here's just a kind of a weird statistic. You're more likely to be admitted to an emergency room with a pogo stick injury than you are to get a blood clot from the Johnson & Johnson vaccine. So that's why the pause after 10 days, there's like, okay, fine, all systems go. I think they did a very thorough job, but it's something to think about if you're thinking about which vaccines that you may or may not want to get. Messenger RNA vaccines, we do have rare cases of myocarditis in men. Johnson & Johnson vaccine, we do have rare cases of blood clots in women. All are completely treatable. No one died. You know, I'm not saying that this is a mild thing, but you go to the hospital and you can be treated. So there is full recovery from it, but it is true. You do need to seek medical help. You can't stay at home and recover. but you can go to the hospital and recover. These are incredibly rare sites. So rare that I was shocked that they even stopped the distribution. I was just like, what? So, so that's just something to think about, right? You want to think about the different layers and different types of things. You know, you may want to, as I said, I had 3 sons. They're all young. One is here at UGA. They all got 3 different vaccines. I just told them pick one. I didn't care. Yeah, no, that's absolutely right. You know, don't, you know, we sort of, you know, we're all very intelligent people, and what happens if we don't have information? We sort of, our brain takes over with imagination, right? We have this imagination, and next thing you know, we're going down some social media rabbit hole, and we get down there, all these other rabbits are down there, and everybody's reproducing, like millions of rabbits, and we need you guys to come out of that dark hole and find somebody that has reputable scientific information. I usually use a mnemonic called AFRAID, A-F-R-A-I-D. When you're talking with somebody who's vaccine hesitant or vaccine resistant, A, accept them where they are. Wherever they are in the evolution of their thought process, you need to be willing to accept that. F is fear. Understand that there is real fear and have empathy for people. The next is R, just as Dr. Allen said, refer people to their physician. Physician is a host of information and can answer really highly technical questions. The other A is be an active listener. Try to listen more and talk less. Let the person talk. I is one that I always like. It's I get it. You should say that at least twice while you're talking to the person. I get it. And then D is data. If you can, always cite some data to help the person begin to think and formulate their thoughts. So I use that mnemonic, AFRAID, and try to move forward when I'm having these conversations with people.
Anything you'd like to add?
No, I think they said it best.
Mic drop, right? All right. Well, thank you all so much for being here and again for your great questions. Hopefully, you know, the purpose of tonight is we are a community and we want to make sure that we're here, that we're able to discuss these things. So if there's ever anything that I can do to be of assistance to you, any of our staff that are in the room, our panelists, we can help you get back in touch with them. If you have questions for them, please don't hesitate to reach out and ask. But again, we just thank you all. If we could just show some appreciation for our panelists again this evening. Excellent, excellent job. Thank you all. I'll ask our panelists to remain for just a quick moment afterwards. And everyone else, thank you so much and have a great evening. I know. Sorry. Why did you get it? Oh, you want me to go through the whole bio? That's what I was about to say. I'll just do names. Okay, I'll do names. Got it. Okay. Okay. I'll introduce our panelists. Okay. Should they use those mics maybe? Or their audio, is it good now?
Yeah, it's fine.
Okay.
It just
okay.
Technically, they did use this.
Okay.
So I just wanted to double check that would be an accurate step. There's no
thanks. You took it. Y'all do well. Your hair looks cute. I like all those. Did you use a wand or a curling iron?
No, it's a brush.
Oh, wow.
Thank you.
Looks good.
I have naturally very curly.
Yeah. I know this is obviously not my hair, but I've tried to wand it and I struggle with the wand. So usually when people have curls like that, so I was like, is it a wand? I'm like, I want curls like that.
I finished practice. I was kind of like, this better work.
I got you. I like it. All right. Thank you. I appreciate it. This was fun. Okay. Okay. Do you want me to ask the question again too?
No, your first
It was like, what was your personal experience? Your personal experience, your exposure to the vaccine. Yeah.
Why did you want to get the vaccine? That whole thing about me getting it. I just really, it's just like the medical side. Like, if you are why the medical. Oh, okay. That's what I'm trying to say. Yeah. Overall, like, it is safe. It is okay. That's okay. Just kind of like, I'm gonna get working there.
Okay.
So this just the
Yeah.
Oh.
But don't you want them on the stage? I have them enough of them on the stage.
I mean, I'll sit. I'd love to listen again.
Yeah. Okay, if you want to sit, that's fine. I got a few people.
I text your driver, by the way. I know.
Oh, I learned so much. I want to talk about this.
Bless his heart. And he says he's going all the way to Atlanta and then having to come back here tonight.
Yeah, that was really excellent, especially with the variants. That makes it more sense about why it has a lower efficacy. I didn't realize that was why they came out later.
That was really good.
Yeah, I'm telling you, rock star. I'm telling you, it's like, this lady's like. Yeah, oh, really? Okay, good.
Yeah, it does. Okay. We would not confuse the cat with an elephant. That's right.
And your immune system won't either, I promise. Okay, I'll see if I can make that work again. It just came out of kind of like.
But maybe a couple of people might get more, might get vaccines now. They might think about it. At least they'll start thinking. All you want is people to start to think about it. Mm-hmm. Just try to give them something different to think about than misinformation.
That's at the end. I just hope it's for.
That was
she has a serious result.
Right.
Yeah.
I hope it's for reasons like that and not because we just filled in because of the people.
Because that was a great question. Like, I've already had COVID. Why should I get vaccinated?
Right.
And it was like, boom. That is like
Right.
such, because that's such a great question.
That's a great question.
And it's a great answer. And to finish off with that, afraid, I was nailed it. Like sticking the dismount.
Right.
Jen, are we good to go?
She said sticking the dismount. Did you hear her say that?
So just reintroduce them again and ask the question. Okay.
Go straight into like
Fertility.
Well, we'll just have you ask the question.
Okay.
Yeah.
Okay. All right.
I mean,
Okay, I think we're ready. Y'all are ready?
yeah.
Okay. Okay. So we have with us Dr. Stephanie Allen and Dr. Jane Morgan. And if you all could just talk to us a little bit about why you chose the COVID vaccine and some of the things that common questions or myths that people have. I know one is about fertility, concerns about the heart, so anything of that nature you'd like to expound upon.
So, in speaking about the fertility concerns with the COVID vaccine, I like to think of this in terms of the myths that surround this vaccine. And I like to say that, myths tend to pop up like mushrooms after a rainstorm. And in this particular myth really seemed to originate with some concerns that were brought about by what I politely call some anti-vaxxers, anti-vaccination folks that wrote a letter to basically the European version of the FDA. And these folks had a concern about the protein in the vaccine, or at least the protein that your body was going to make after the vaccine, that was similar to a protein that exists in a human placenta. Therefore, thinking that that could cause miscarriages and infertility. And it's just simply not true. Basically, the antibody that your body makes after having COVID or after receiving the vaccine is an immune response that is generated, that is very savvy, actually, that is by a very healthy immune system and a very smart immune system that would be like your immune system not being able to distinguish between an elephant and an alley cat because they're both gray. And it just doesn't happen. It doesn't make sense. The science behind it is that there are some similarities in these proteins, but they're minute. There's a tiny little amount of code in the protein around the coronavirus, the COVID-19 virus, and the spike protein that is similar to the protein in the placenta, but we're talking about a tiny amount of code. We're not talking about the protein itself. So there's some similarities, but the proteins are very, very different. So again, the immune system is very savvy. It's very smart. It's not going to mistake the placenta for this COVID vaccine, the COVID virus or the antibodies that it makes. So I can reassure you the number of patients in my population who have become pregnant while receiving the vaccine or just prior to the vaccine, we've not seen any increased risk of miscarriages or infertility going forward. So I'm here to reassure you that myth is a myth.
And, I was here on campus visiting my son with the Parents Leadership Council in February of 2020. And we already knew, certainly scientists knew from our WeChat app where we talk with all of our international colleagues, that there's this SARS-CoV-2 virus. And, there's this, possible disease coming. And we also knew, because it was called number 2, that this was the second time we were seeing it. And so we knew we had seen it before. We saw it in 2003 with the initial severe acute respiratory syndrome SARS outbreak. And then we saw it again in 2012 with the MERS outbreak, Middle Eastern Respiratory Syndrome. Both of these outbreaks of coronavirus sisters were off our shores outside of the United States. But alarm bells were going off in the scientific community for a number of reasons. One, this is a virus. Viruses replicate quickly and they mutate quickly. They are formidable foes. And two, it's spread by respiration, by aerosol droplets. Why is that a problem? It's a problem because we are Homo sapiens. We are earth dwellers. We are human beings. We breathe in and out air. We do not have the option of opting out of air. Unlike other outbreaks that could be bloodborne or waterborne or fecal-borne or body fluids where we can protect ourselves with some degree of discomfort, we cannot separate ourselves from the need for air. So this was a big concern. And so I was here on campus in February with my son in the Innovation Center in one of these parent meetings, and during a break, I was talking with him about this virus that's coming. I didn't know what to expect, but I was very concerned. I was very worried about it. He has asthma. I wanted to make certain that he was taking his medications, that he was eating healthily, try to avoid junk food. I need you to be as prepared as possible for what I didn't know, but I certainly understood that it was going to be a respiratory transmission. And interestingly, while I was talking with him, what I thought was a quiet conversation, another parent walked over to me and said, "Oh my God, I was just saying the same thing to my son," and it turned out she and I were both doctors, and we both were hearing the same things, and we both were there talking with our children about preparing them for what was coming, and that was in February. And so to get the vaccine was a relief to me. I have 3 sons. They all got the vaccine. One got Moderna, one got Pfizer, one got Johnson & Johnson. I wanted to make certain that we were safe. This was going to be serious. It has the potential to be lethal. It was not selecting its victims. And I wanted to make certain that I was safe, that my family was safe, and that also we had a degree of responsibility to society to make certain that we weren't a part of the problem and spreading it on to others as well. So as soon as I could get the vaccine, I got my vaccine on January 2nd. It became available in December to all frontline workers. I was not a frontline worker, but I was included in that second rollout. And the day after New Year's Day, I was eligible, and I went in and got my first shot on January 2nd. Was very relieved and happy to do it.
Thank you.
Thank y'all.